A patient today had been buprenorphine for a good amount of time. They had changed people, places, things. They were going to meetings regularly. They had a great support network at home, and they were engaged in psychotherapy. Their therapist believed that it was also a good time to decrease your buprenorphine dose or to see if they could come off of it. The patient wasn't as concerned about relapse as they were concerned about withdrawal symptoms. And they actually had noted that if they missed a dose of their buprenorphine, for even a couple of hours beyond when they usually would take it, they would have pretty significant withdrawal symptoms. The withdrawal symptoms that they were having included insomnia, anxiety, sweats, chills, muscle aches and pains, and also quite a bit of upset stomach and even diarrhea. And so we talked about a couple of different medications that have been used for a long time in terms of opiate withdrawal that could be utilized for tapering them off their buprenorphine. One of the medications we talked about was called clonidine. Clonidine is an older antihypertensive that also is used in opiate withdrawal. Patients, when they take it and they're in withdrawal, will say that it may, or at least many of them will say that it helps with insomnia, it helps with anxiety, it helps with some of just the kind of irritability and some of the other symptoms that go along with withdrawal. If you watch old kind of clips of the show The Wire from down in Baltimore, you'll actually see that when individuals are going through opiate withdrawal, they'll often have a patch on their shoulder that's actually a clonidine patch. So this medication has been used for a very long time. It's in both patch form and it's in pill form. Another medication that I'll often use would be a very low dose of something called Robaxin or methocarbamol. This is something you've got to be very careful about, but it can really help with the muscle aches and pains and cramping that can go along with opiate withdrawal. Utilize as low dose as possible for as short a period as possible, because it's actually a muscle relaxer. It's an older muscle relaxer that can help specifically and is often used in opiate withdrawal. Obviously, that has its own abuse potential, and you have to be very careful about making sure that patients aren't going to take more than they're supposed to. So often involving family or friends, etc., in the process. There's another medication called Bentyl. And Bentyl is or dicyclamine is a medication that's used to help with the stomach cramps and diarrhea and some of the other GI symptoms that go along with opiate withdrawal. So those are some of the things that I may consider using, if appropriate, for a patient where we're going to taper buprenorphine for a couple of days after each drop to help them with some of the withdrawal symptoms. If you believe this video pertained to you in any way, please be sure to reach out to a mental health professional to set up a visit or discuss with them directly.